on the News Channel 5 network. This is OpenLine.
Hello, everyone. Welcome to OpenLine. Very good show tonight, important show. We're going to be talking all about the Affordable Care Act. How many plans are there in Tennessee? How much will those plans cost? Is it the right thing for you to do? This is an opportunity for you to call in with people that know what they're talking about, who can help answer some of your questions. Again, open enrollment is underway right now. There's a finite period of time. It goes through December 15th, I believe, and so that's what we're going to be talking about tonight, and a chance for you to call in. There's so many people that have so many concerns, issues surrounding healthcare. This is a chance to talk about that, hopefully get some questions answered. Happy to have with us Jackie Shrago, certified application counselor. Jackie, thank you for being with us. You've been here before. Thank you.
Thank you.
And Tony Garr, also certified application counselor. Thank you, Tony, for being here. You've also been here and been talking about these issues for a long time. So thank you. So, all right, where are we right now? Let's give kind of 101 on where we are right now. And who wants to take that? Yeah, Jackie.
All right, so we have a couple of new carriers, a couple of new insurance companies in the Nashville area. So Nashville area is Davidson County and the surrounding counties. It's a little different beyond that, but essentially there's some new carriers, which makes it very competitive. So the insurance companies have realized this is a good market. So there are two new ones that have not been in here most recently. One is one maybe people have not heard of, but they're very large nationwide and better. The other one is that Blue Cross has returned to the Nashville market. But in addition to that, we have Cigna and Bright Health, and the other one is Oscar. So, and they each play to slightly different people that they think are attractive to them, but they all have very competitive rates. And that's what makes it a real advantage. When you look at them, you got to figure out what your doctors are. So you want to look at it both in terms of price, but also to be sure that the doctors that you may already have are ones you are going to be able to keep. If you don't have a doctor, it's easy to find hundreds of doctors that match your needs and your location.
All right, so that's very good, and that's a tip on kind of how to assess these plans. We're going to get into cost in a moment, but the bottom line, what you're saying, is there are 5 different carriers, I guess.
Right, carriers or insurance companies.
Because it made a lot of news when I think Blue Cross said they were getting out of it. There was a time when we didn't have 5 carriers.
There was a time when we only had 1 or 2 here, okay? And Blue Cross pulled out of some parts of Tennessee, but stayed in other parts. So they still cover all of the rural areas, but they're now back statewide.
So that's kind of a big deal. We're going to talk about cost in a moment. But Tony, what about just, we're seeing more come back in. Why do you think, if they left, why are they coming back in?
Well, it's gotten to be a pretty stable market, and people are seeking insurance, and you know that has not stopped. And the other thing that's happening too is that people who need TennCare, maybe they're lower income, they fit into a certain category. You know, we're enrolling people for TennCare as well as the ACA. The difference is that ACA will open enrollment will end on December 15th, but enrollment for TennCare Cover Kids is year round. But the thing that Jackie and I do mostly is we are assisters, and then we use this phone number, the 844-644-5443, as a way that people can call that number, and they can connect with myself, with Jackie, we'll set up an appointment, or with other assisters, you know, across the state. So we have a way of helping people get connected with the sisters to get them enrolled into whatever program they may fit into.
And you all are volunteers.
Yes.
You're volunteering your time.
That's right.
You're not being paid.
Nope.
And all right, so if somebody calls in, we'll put this number up over and over. And that is the number,
That's
right?
the number.
All right, so someone calls that number, what happens?
So they talk to another person on the phone.
They talk to a human being.
They talk to a human being. And if we are busy when they call, we'll call back within 24 hours, usually less than that, but easily within 24 hours. And we do a little bit of screening. We ask them what their situation is. We ask them a little bit about their size of family, whether they're working or not, and where they live, because that has to determine how they're going to get some in-person help or in some cases we'll help them over the telephone. We try not to help over the phone as too much because a lot of this stuff is confusing for folks. You know, they're not sure about the terms, and when you can show them on the computer screen what we're looking at and what might fit for them as we talk, it's a little easier to figure out what to do.
So it's better. So they call the number that we put up,
right?
And then you would set
make an
up
appointment.
And you make an
that
appointment.
person makes an appointment. That we find out their zip code. We look up on our appointment system and see when we've got a slot available that fits their schedule, a location, and so on. And then that is set up in our system, and then they get notice of it, and so do we. So then, and then usually one of us talks to that person again before they actually come in.
Good.
Yeah, they get a lot of help. I spend a lot of time on the phone just walking through the process for folks, and they'll have questions. And then also we want, when the people come in, there's certain things we want them to bring with them so that we can sort of help them even more. Many times any kind of documents that's required, we can just upload them to their application on the Affordable Care Act or on the TennCare application. So it's a pretty convenient way of getting people enrolled and getting them health insurance.
So they call on that just to set up an appointment. How long should they budget for that?
We allow an hour or so for an appointment.
So
we
they
really
would
try and make it, usually takes about an hour. There's a lot of confusion. People have a lot of questions. We try and make sure that we're answering all the questions. They have a lot of different family situations. Okay, that can affect things. You know, sometimes there's an older person in their family who may be working, but you know, maybe in school, maybe working part-time, all those kind of scenarios. That changes what the number of people are. Essentially, we're looking at the tax household. You know, who's on the person's tax return, and it's a household return, but everybody might be different in different stages, and the same application works both to get insurance through the Affordable Care Act, but it also may put their children on TennCare or the Cover Kids, where there's no charge, no premium charge to the consumer.
So let's talk money.
Okay.
And that's the thing. How much do these cost? Well, and I'm sure there's a range.
There is a range.
There is a range.
And one of the things that can be confusing to people is they go in online and they think they can put in their little information, and they can, and then they immediately get a number, and they think, oh, I can't afford that.
Right.
Well, but that's not the number they're affording. That tells them what the discount is. So by putting in their income, there's a calculation of how much discount is given to them once they sign up for a plan. So until you look at the plans, you don't know what it costs.
You know, that's a big myth, and just to sort of make sure people are aware that the Affordable Care Act is still here, it's alive and kicking, so it's still there. Premium tax credits and cost sharing reductions are still there, so they're built into the process. And people, if they have a medical condition, I mean, I was just talking to a person the other day. Really, they didn't realize that medical conditions like pre-existing conditions are not part of the Affordable Care Act. That was the great achievement of the
it gets covered.
Right, it gets covered.
Yeah.
They're not denied coverage, and they're
Right.
not charged more because of a pre-existing condition. But now premiums they're based on age, they're based on where you live,
and income.
And income. So
let's give you some examples.
Yeah.
So if you're a 25-year-old female and you get about $13,000 in income, you have choices of, I've got 11 plans, and they all range between $15 and $28 a month.
Okay. All right.
If you make a little bit more, let's say you make $19,000. Now again, this is a single person. Those range between like $55 and $80.
Okay.
Okay? So you can see that it varies. Now, if you have a child and in those income ranges, then that child's very likely eligible for TennCare. So you wouldn't be paying a monthly premium. And those costs I just gave you are the monthly premium that you pay. You pay it every month of the year, no matter what.
Right.
And then each of those plans has a different deductible, and there's been a lot of challenge and a lot of talk everywhere about the amount of the deductibles. I've given you plans that are in this category that have reduced deductibles, and that's really important on the Affordable Care Act. So there are two kinds of help people get. One is to get this discount applied to their premium, so we get numbers like $20, $50, or $60, $70 a month.
Right.
That's where the discount has come in. But the other piece is, what's the deductible? What is the deductible? It means I've tried to get health services with this plan I've got. What do I have to pay before I get any service from the insurance company? Well, many of the insurance companies have gotten smarter, and they've realized that it's important for people to get primary care, the basics of a doctor appointment, maybe certain kinds of prescriptions, the basic ones. Those are done now as a copay, and in many of the plans, that happens before they meet any deductible. So they can always go to a primary care doctor. Now, if they have to go to more specialists, they have to get more tests done or those kinds of things, they may actually have to pay those. But it is very much geared toward keeping people healthy. So the physical is free, flu shots are free, but then this mechanism where they can get some primary care doctor visits at a copay, that is $10, $20, or maybe $30, that's a pretty good arrangement.
Right.
So
what do you think? Okay, I want to talk more about prices.
Okay.
And I want to encourage people to call in. With your situation, maybe we can help kind of give you a ballpark.
Yeah.
But what is the number one, or what are some of the top three kind of misunderstandings that people have about this right now, the Affordable Care Act right now? When you're talking to people on the phone, they'll say, well, I heard this, and that's actually not the case. What are some of the misunderstandings that are out there that you'd like to clear up? And Tony, I'll go to you.
Well, I mean, I think the first thing is that people don't realize that the discounts are there, and that, you know, actually it's very affordable. It depends on the income and the age, once again. So if you're, you know, upper middle income, you're likely not to get as maybe much discounts. And then some people, if you're over 4 times poverty, you're not likely not to get any discounts. But really, most Tennesseans will get some kind of discount. And so I think the number, at least what I've seen, people are just surprised that they can get good insurance that's affordable and that they can pay for.
And are they surprised it's still there?
yes.
Because we've heard so much talk about how it's going to be repealed and replaced and done away with, but it hasn't been,
It
right?
hasn't been, no.
It's still there.
Right. And there are all kinds of things that, the thing is, what people have to recognize is the amount of time that there's going to be a lead time before it could ever go away. That's at least a year and a half. Okay, or a year and 3/4 before it could ever go away. So you will know in plenty of time. In the meantime, you want to take advantage of it. Okay, because it really is good health care services at an affordable rate. So what I often hear is people say, "Oh, I can't afford it." Well, I say, did you get somebody to help you figure out what you make? Okay, and look at it properly online. And sometimes people have called the 800 number that's associated with the Affordable Care Act, and they haven't displayed their income properly. So one of the things that, one of the reasons we say it's an hour, it's not an hour to do the application, believe me. That's maybe 10, 15, 20 minutes at the most. It is, how much money do you make? So we have to say, all right, so how much money are you going to make in the year 2020? All right? Most people don't know.
Yeah, a lot of people don't know. Yeah.
There are an awful lot of people who are self-employed. Well, this is a large population who don't have insurance offered through their employer. So if they get it offered through their employer, they may know what they're probably going to make next year. But all the rest of us who are not employed in that way don't know. So we help people sit down and figure out. So they may have one job, they may have 2 jobs, they may have expect to change jobs at some point. They may be doing Uber driving. We have a lot of Uber drivers, okay?
All right.
We have a lot of people who have some sort of jobs where they get paid intermittently. So they might be bartenders and they get paid for a job, but it's not the same as getting a paycheck every week. So we have to help them figure out just a good estimate. And we can always work within a range. You know, if you can say to me, well, I think I'm going to make between these amounts, we'll help you figure out what to do.
Right.
And one other thing, I think, at least another thing that I've seen, is people don't realize that, gosh, they're in April of 2020 and they realize their income has changed. There's a simple 800 number they can call and change their income.
Right.
And so, you're not stuck with what you think you're going to make for 2020.
The enrollment period may close, but
Yes.
you can amend.
Yes, you can always amend.
You can amend that part of it.
Yeah.
Right. And we help people figure out, if that happens, what they're likely to experience. So that's really an important part of this. And that's one of the reasons we spend some time explaining to people how this works. Because first of all, we want them to understand how the insurance works. But we also want them to understand that they're not making a commitment that's lifelong. So they're afraid, what happens if I have to pay it back? Well, we can talk a little bit. That doesn't usually happen. You get a discount. Let's say you're eligible for a discount of $400 a month. Okay? So you get one of these plans that say $20. Now, we've said your income is $13,000, but it really ends up being $15,000. You are going to owe a little bit back, but you're not going to owe the $500 you got as a discount. You're going to owe maybe $30 a month back, $20 a month. You may fall into these little higher ranges. So it's all based on the fact that you are making an estimate of your income, and this is making an estimate of what your taxes are going to be. And how does that all get reconciled? It gets reconciled when you file your tax return in April of 2021.
Wow.
Okay? So it really is a long term, but we keep people informed during the year so that if they make changes, we can help them figure out how to do that.
All right, we have to take a break. I want to ask a couple more things. Are enough people taking advantage of this? Do you think people are taking advantage of it in the numbers that they should? What have we seen over the last few years? And again, just to encourage people to call in with questions. This is a chance to get a question answered. Of course, you can call the number there on the screen as well. But go ahead and give us a call. It'd be good to hear some of your questions, and that will help other people get a better idea of what they can do to benefit from all of this. We'll take a break. Be back right after this.